We're not live. All right. So welcome to today's discussion on John Carpenter's The Thing. All right, group, where would we like to start?
I guess how they went all, they didn't trust each other. I guess we can start with that. I feel like compared to all the other horror thriller movies, I think they were pretty systematic in how they were killing or testing each other off. I think, sometimes I see these movies and they make so many stupid mistakes and you're just bro, why aren't you thinking? But they were very thoughtful. Okay, you were with him, so you might be contaminated, so we're going to put you there. Okay, we're going to test everyone's blood. So they were very systematic in that way, so I appreciated that because it made sense, why they were killing these people off and why everyone was agitated. But yeah, that's my first thought.
I mean, they are a group of scientists.
Yeah, but sometimes even the scientists in these movies are
fair.
Yeah.
Yep.
It's really desolate and fully done, so maybe some sort of psychosis there.
Yeah, we're focused on this behavior. I heard, there's this pervasive suspiciousness. I think as a golden rule, especially when we're dealing with people and people's behaviors, and you've heard me say this before, but irrespective of why the patient made the appointment to see you in a clinical practice, we're talking about psychology and psychiatry. I would ask that you always give your patient the benefit of the doubt. It's always normal until it's not. And if you're setting up a psychiatric practice, inpatient or outpatient, that element of abnormality is going to approach 100%. Right? It's going to be but we should all resist the temptation of jumping to that conclusion, even when it's a very common outcome. And if you do that, even though you're going to be wrong in your initial assessment that it is quote unquote normal, the vast majority of time you will actually adopt a style of patient care that is compassionate, which is first and foremost. So if we apply that reasoning here, I think the first thing that comes to my mind is they better be paranoid and they better be hypervigilant because they are very desolate. They're very much cut off and isolated. And if they make a wrong move, they are not going to last long, right? You've got, sub-freezing temperatures, and then you have this alien life form that's masqueraded with a, Edgar suit, and it's not going to turn out well if you're not hypervigilant. However, there are aspects to what's going on here that suggest that there might be more to the equation, there might be more to the story. And certainly we could be tempted with thinking that maybe a lot of this is a product of their mind, and if so, whose mind are we viewing this movie through? So there's always that direction we can take as well. Other thoughts? Okay.
I was thinking more like a substance in the actual base that they're in, and it's making everybody else paranoid, and that's kind of making them turn on each other. That's what I was thinking when I was watching the movie. I was okay.
Yeah. So if we're thinking that we have crossed that line and we're dealing with an abnormal behavior and therefore a DSM diagnosis, we can't begin to discuss that differential until we think of or consider two things that might account for that. And what are those two? They're always at the beginning of our conversation.
Substance.
And?
Physical.
Yeah. Right.
Physical disorders.
Yeah. With regard to this being that is The Thing, 1982's John Carpenter's The Thing, being a fictional case of a mental disorder due to an underlying medical condition. Any evidence in the script that would be consistent with this? I mean, is it scripted for us? Is it spoon-fed to us? So I'm going to take the group hesitation as a no. The next question that will always follow in clinical practice is, despite there being discrete evidence, should we now or could we now be reassured that this is not a case of a psychotic disorder due to an underlying medical condition? And then why or why not? So the answer is depends. And I want to put this in terms of a shelf context. You have a shelf exam question in which you believe there is a psychotic disorder as a single best answer. Schizophrenia is like choice D. The 5 or 6 sentences that make up your case vignette, there is no discrete mention of an underlying medical condition. Is it reasonable to assume that therefore one does not exist? If the individual is 19 and female, you're probably going to be safe in thinking, in the absence of that information, one likely does not exist. If it's an 86-year-old male, I don't know if you can make the same assumption.
Right.
Right. So we do identify that there are 2 protective factors when it comes to physical health: age, okay, and sex. Right. Women are just healthier than men, and younger individuals are just healthier than older. So if the case vignette is an older man or if it's a younger woman, I think it's fairly straightforward. Of course, if there are in either of those 2 intermediaries, then it's a coin flip. Hopefully it does not appear on a shelf exam. But when it does appear in real life, you'll have to make a decision on which type of doctor you want to be. If you're conservative, you're still going to think, I'm going to treat this as if it were an 87-year-old gentleman. If you're not as conservative, you might think there's nothing to it and go on from there. And there really is no right answer here. Right? It's really how you want to practice, or in this case, how you want to analyze a film. We can't even get to this question until you decide whose view or perspective you're taking in the film. In either case, the 2 men left standing are middle-aged. I would suggest that we treat them as if they are that proverbial 86-year-old gentleman and say that I'm not comfortable in definitively ruling out that if there were evidence of psychosis, that it isn't due to an underlying medical condition. But that's my rationale for getting there. Similarly, if that is number 1, 1B would be a psychotic or mental disorder that is the direct and physiologic effect of a substance. So if we were to review this script, if we were to actually go to scripts.com and go to that search function, would we find anything explicitly in the script? Alcohol? Well, I think before, and you're right, and just to digress for a little bit, what are the 5 plus 1 substances that can induce psychosis?
Alcohol.
Psychedelic.
Is that acronym? The MICA acronym?
Oh.
Can you give it to me in order?
Oh God, no.
Methamphetamine.
Alcohol. No, that's later.
Inhalants?
SE.
It's
MI.
MI.
Inhalants, right?
Yeah.
This is
This may come over a live stream as a little bit hectic. They're actually nailing this, right? There's a lot of mumbling going on, but the right answers are being mumbled.
C. Is that
Oh,
like
LSD?
cannabis? K
LSD.
is alcohol.
I don't think I saw Micah with an
Oh,
L.
yeah.
Hallucinogen?
Yeah,
Yeah.
we got it, right? And you did nail all 5 of them. Just for purposes of people listening at home, methamphetamine and other stimulants, inhalants, cannabis, alcohol, which of course would include sedatives, right? Sedatives are nothing more than alcohol in pill form, and then hallucinogens, right? Any of Micah in the script of the thing?
What's McReady drink when he's playing chess? Like right in the beginning, and
Yeah.
he loses, and he dumps that alcohol that he
It's
dumps
alcohol.
on the,
It's alcohol.
on the
Cannabis.
machine.
Yeah, we have 2 of the 5.
Yeah.
Yeah, we have 2 of the 5. So I'm not ruling this out, right? And by the way, hypothetically, if we were to edit out those scenes, right, doctoring the script, we still have to ask ourselves that secondary question: does the absence of it appearing in the script reassure us? And the answer is no, and that's period. That doesn't matter if you're young, old, male, it doesn't matter. The answer is always no. So to best address the role of substances in any case presentation, the clinician should always maintain a high clinical index of suspicion. Right. So, but in this case, I think that's going to be high in our differential. I do.
How does the lack of sleep play into it? Because I see Mac as the movie keeps going on and on and on, he keeps saying, I think he said multiple times that he's I'm on 2 days, 2 days of no sleep, 3 days of no sleep, and he gets more and more and more and more paranoid.
Yeah. Yeah. So I'm going to actually answer your question, and then in doing so, kind of lift one of our project groups, the Instagram project group, because they go through this every week when it comes to formulation. Because the way that 3x3 rubric is filled out is the answer to your question. We identify, at least one character does, we identify that sleep or lack thereof plays a prominent role in this movie. We have to determine whether that role is as a predisposer, precipitant, or perpetuating factor. Because it could be either, or, maybe several of those three. Now, for sleep, I would say that is a biological. So in terms of the way we configure this, if bio happens to be the first row, we have to determine the column, right? Is it as a predisposing, precipitating, or perpetuating biological factor? And I don't know if I know, right? But that's where I would start the conversation. At the very least, I think it's perpetuating,
Yeah.
right? At the very least. Yeah, and I think that's a core element to this. Right? I think we're going to wind up circling around to it.
Yeah.
I just want to see if you guys get there organically.
Because I wondered, because I know when there's lack of sleep, there's times where people can see certain things, have hallucinations, and I didn't maybe the thing is one.
Mhm.
I was also thinking less mental and more disease wise. Like the dog could be carrying rabies or something like that, which is making them it could have bit one of them and it transferred, and then they almost start freaking out.
Yeah.
I was thinking that mostly too.
So this is basically just a remake of Cujo as far as you're concerned.
Yeah.
Yeah.
Cujo, stress, favorite thing movie. though.
Right.
Mine, at least.
Yeah. So along those lines, again, we wouldn't rule out that this is due to an underlying medical condition, infection, and you're taking the opening scene as a metaphor.
Yeah.
Yeah. Bravo. Yeah. I would certainly keep that in a differential. By the way, brownie points. What more recent movie alludes to that very scene? And I know you've guys.
How recent?
2010-ish, plus or minus.
The opening scene with the dog.
Hmm.
Why are y'all looking at me?
You're the one that's what?
Here's a hint. I don't know if your reasoning is accurate. That's a hint,
Wait a second.
but it's not horror.
It's not.
Yeah, that's
Is
a-
it very popular?
I think so. Yeah.
Like Marvel,
Hmm.
Disney? 2010.
Ish.
Oh yeah, he's not like Marvel.
I do. Wait
Yeah.
Just,
He's like, wait, that's not true.
I'm a DC fan. Let's leave it there.
Oh, okay. Understandable.
Disney or
The only
DC?
thing I know
No,
is
it's Disney.
Dolls. It's like both.
Huh? No.
Yeah, no, literally.
Yeah,
both.
literally.
The movie's
That's-
from
that's-
Disney, but he's
that's not true.
Both Disney.
Oh, I don't know. I'm just thinking about
What
Dolls.
was not? Oh, I was just
Disney movie.
said Disney.
Yeah. Here's the hint, guys. Because I
No, I'm
no,
thinking of all the
This,
princesses. Something like that.
I was like,
in this movie, the character was thought to be a dog for the longest time.
Oh, is this a Coco?
that's too recent. Or
Wait, yeah.
I might be getting the year wrong now. So I'm
Maybe.
Sure.
Thought to be a dog.
Is there a Goofy movie? Like,
A Goofy
There's so many of those.
like Dalmatian.
I'm sorry, I was off. 2002.
Oh, I was
That's
sorry.
something-
When you get my age, 2010 feels like
You
2002.
know what I'm saying? Yeah, there. That's what I was thinking when I was like 2010.
Yeah, when Stitch is put in the kennel for the
Yeah.
first time, those dogs
Yeah, he's
huddling in the
like-
corner, it comes right out of the thing.
Wow.
Brief tangent there. We're back. We're back to talking horror. What else? There's definitely two more things I want to bring up about this movie that we need to discuss.
I thought that maybe the people could be having an identity crisis because the thing takes form of, it could take form of anything. So maybe they don't even know themselves if they are the thing.
Yeah. Yeah. And if that identity crisis rose to the level of psychosis, which I'm already hearing people discuss, there's a name for that syndrome.
Oh. The imposter thing?
Mhm.
Is that Capris?
Yeah. Yeah. Yeah, so the thing might be a fictional case of the Capgras syndrome, CAPGRAS syndrome, which is the delusional belief that somebody has been replaced by an imposter, in this case, an alien life form.
And I feel like in the scene when they're like testing the blood, it's like they don't even know. Like there's a fear that they're going to be found out, but also it seems like the fear that like they're going to realize that they're the thing.
Yeah, the
That's like the best horror movie. It's so best horror movie scene is the blood
It's a
testing.
very intense
Nothing
It
scene.
like
was
that.
intense. I didn't know.
It's crazy. And then even like the final scene with McCready and who's the other one? I think?
Charles.
Charles.
And they're like sitting there and like it's like you don't even know if they know if they're the thing.
Mhm.
Or I think that's such a good ending. Like, do they know? Are they question themselves? Are they question each other?
Yeah. So let's talk about that a little bit. And maybe not necessarily from a pure psychiatric perspective, but certainly the addition of the lore. What else is going on there?
Or,
Yeah.
Well, they're afraid that they might have a thing inside of them, and they're like, well, let's just hang out here just for a little while, because they don't want to destroy humanity in a way, because if they escape, or if they try to find an escape, then, they could basically kill everyone.
Right? And it's like, do they know that they're infected? And I like the implication that like they're like, let's just hang out, like knowing they're gonna die.
Yeah, didn't they say like let's see who dies first?
Yeah.
To see like who
Mhm.
would, like if this, one of them were the thing, maybe like who would kill who.
Yeah.
Any allusion there as you're watching that scene? Anything come to mind? Where there is a character that is identified as a scourge, and if the scourge leaves the continent, it could actually spread throughout the planet and wipe out humanity. Wait,
Layer?
huh?
Layer? Oh no. Oh, like in the movie?
Oh no, that is the movie, right? That's and that's Blair, right? But it's another movie.
Oh, I'm sorry. Interpreted.
No. So basically, I mean, many people will look at The Thing as a remake of this classic.
Oh, is it the show Amanda or something? No, it was a Korean show.
No.
It's a remake of The Thing, or it's a remake before?
Before.
Okay.
Something spreading.
Exactly what I just mentioned. If you
Oh,
describe
the
that final
Talking
scene,
Adventures? No.
Jurassic Park.
but yes, but no. Yeah.
That was
No, it's Bram Stoker's Dracula.
Jurassic Park.
Dracula.
Bram Stoker's Dracula. The Count was referred to as a scourge, and if Van Helsing thought if the scourge was allowed to leave the continent, it would spread throughout the planet and erase humanity, which is the exact same thing that happens at the end. So basically, what you're looking at when you see Childs and McReady is Van Helsing and Count Dracula sitting there staring each other down. Yeah. Now, there's one other twist to this. Anybody here ever see the 2011 film The Cabin in the Woods?
Yeah.
There is an ultra brief scene, literally in seconds, in which Joss Whedon gives us the outcome, or at least his impression of the outcome of what happens next. Right, so I don't know if I should just set that as a teaser and have you guys watch it and figure that out, or we'll come back maybe as next week's Q&A with it. But if you haven't seen The Cabin in the Woods, you should anyway, so I don't feel at all guilty saying that.
First time's worth before he was Thor.
Other observations, The Thing. About 10 minutes left. So nobody's nerded out or deep dove this film?
No, I enjoyed the film. Because, I was like, oh my god, they're actually using science, guys. They're thinking. That's literally all I thought about.
I said it this morning, but that like spaceship looks exactly like the Millennium Falcon. Like I didn't know if that was like a tribute to it at all, but it looked exactly like it.
I think the only mistake they did was with the Norwegian. Like, I get the Norwegian was putting a gun towards them, but like they could see that guy was aiming towards the dog, right? So like they couldn't understand what he was saying, but instead, like they should try to figure out. Like he's human, right? Like they should figure out like what he's trying to say. Like there's probably something to figure out, translate or something.
And a Norwegian scientist doesn't speak any English. Like at
That's
all.
that's what I was thinking
Fact check.
too.
Fact check.
Yeah, but there's a humanity aspect, like, oh, why is this person shooting at a dog?
Right.
That's what I was thinking. There'd be no reason.
The way they accept the dog is so like really I don't like.
It's like,
And I think they set that up as a major twist, right? So you have that humanity aspect, only to find out that it's not a dog, which you know, right? Which then you totally lose the base of that perspective. So let's talk a little bit about the alien. I mean, everybody's talking about McReady and Childs and others. Nobody's ever considered taking the perspective of the alien here. Right? Which again, I'll point you towards Lilo and Stitch, right? Disney pulls it off where when Lilo is talking to Stitch that one night saying, do you think about them too? I hear you cry at night. I mean, that's got to tug. I mean, if Night should shut that movie off, you have no right looking at that movie. Any compassion for this alien? This poor thing just wants to sleep. You got these humans tracking it down, trying to burn it, right? The other thing about this movie, kind of piggybacking this general approach of taking everyone's and everything's perspective, pun intended, is that when you actually look into the backstory, this alien life form has a circadian rhythm that exceeds 24 hours. And a matter of fact, the entire movie is one circadian rhythm for this alien, right? This is a day in the life. It is, right? Right? And it kind of gets at, I think, what you were getting at. John Carpenter's The Thing is a fantastic fictional case of a circadian rhythm sleep disorder. Now, there are several subtypes to this, and unfortunately, all may appear on a shelf exam. And in and of itself, the circadian rhythm sleep disorders, like 4 or 5 subtypes, is but one example of a dysomnia. That's a dysomnia. So if you look at the sleep disorders chapter or the sleep-wake disorders chapter of the DSM, we see dysomnias and parasomnias. These circadian rhythm sleep disorders are examples of a dysomnia. The individual circadian rhythm, when you compare it to the day-night, diurnal variation of the environment, could either be advanced or delayed. It could be irregular, which is neither of the above. It could be shift work type, which is obvious. But there's a fifth entity, or a fifth subtype, called non-24. You may have heard this on commercials on TV in terms of medication. But non-24 is when the actual sleep period is consistent but exceeds the 24 hours of Earth's rotation. And it's exactly what's happening here, right? Non-24. Now, having said that, on-shelf exams, what is one of the things other than the actual sleep schedule that might buy you choice A, non-24 is a single best answer? What else should you look forward to in that case vignette to basically be that red flag for you?
That it is non-24 as opposed to
The other
like
circadian,
advanced
yeah.
delayed. That it's like consistent, like over
That's
time.
that's one.
No like sleep hygiene concerns.
Correct.
No history of shift work.
50% of individuals with this condition have another medical condition. Blind.
Oh.
Blind.
Yeah, we learned that.
Yeah. Now, if John Carpenter had asked anybody in this group, we would have suggested that this alien be blind.
Yeah.
Right? Now, there are aliens that are blind, right? And that's Quiet Place. So they kind of picked up on this after the fact, but it would have been nice to have this alien blind. It would have made a remarkable and medically accurate diagnosis. But John Carpenter's The Thing does allow us for discussion and therefore introduction into the sleep-wake disorders. More specifically, the circadian rhythm sleep disorders, and more specifically, non-24 subtype.
If the alien was from a planet that had like a different rotation,
Yeah.
and had like a longer than 24-hour day,
Yeah.
and then came here,
Yeah.
would that really be a sleep-wake disorder, or are we just applying our own?
That's exactly right. Yeah, with cultural sensitivity, there's nothing wrong with the alien. There's everything wrong with the Earth's rotation.
Yeah.
Yeah. No, that's the perspective to take here. Yeah. It would be difficult to introduce this movie as part of a cultural sensitivity class, though. I mean, we could talk about this in terms of a horror class and bring up issues to cultural sensitivity because you all miss this. Actually, you kind of you were circling the drain. You're right there. Other questions about the dysomnias, sleep disorders, the thing. And maybe in ending, we kind of started out with this idea that everything's normal until it's not. I'd like to end with that similar conversation. So when we do address someone's insomnia is a very common chief complaint in ambulatory care practices. The first step is always to review proper sleep hygiene, which is the quote-unquote normal. So with everybody here sleeping wonderfully, what you're about to tell me is everything that you're already practicing, right? That's the quote-unquote normal realm, which would include what? What are some of the things we'll review with patients in terms of sleep hygiene?
Time to go to bed?
Yeah, consistent time, right? Consistent time to go to bed every night, yeah.
Do they wake up in the middle of the night or not? Like, do they wake up in the middle of the night or something? Like, how consistent? Like,
Let's say that the insomnia is referred to as early insomnia, which is difficulty falling asleep.
Okay.
That's all.
Using phones or
Yeah, let's just say the technology. Yeah, but yes, it starts with the phone. No phones in the bedroom. But in fact, nothing in the bedroom.
Caffeine and alcohol before bedtime.
Right. I would certainly after 7 p.m. No alcohol, no caffeine. And I mean, if you really want to get your brain cleansed in terms of prepping for a good night's sleep, it's best to have no alcohol, no caffeine, period. Right, and that's the brain in its most native state in which you're giving it the best chance to work and be successful.
And if they are using their bed just for sleep.
Only for sleep. Right? For sleep and sex, that's it.
So that is true. Like when you like associate like doing schoolwork in your bed, like you actually can't sleep because.
Oh, 100%. Mm-hmm. Anything. Taxes, don't
I
do
started to do that, and then I noticed it was like hard for me to go to sleep. Yeah.
Nope. What else?
Consistent wake time.
Yeah, we mentioned falling asleep. You guys missed wake. And if you're going to sleep in the weekends, that's 1 hour.
Yeah.
Sleeping is 1 hour. Right, so if you're waking up at 7 a.m. to get to your psychiatry rotation, 2:30 a.m. to get to surgery.
What happens if you sleep more? Well, it messes up everything.
Yeah, you could cheat in terms of sleep hygiene, and things might turn out well. But if you're going to review with a patient what they should do, you should set the goals
Yeah.
accordingly, and let your patient tell you which ones they are able to achieve and not. Yeah, so consistent time to bed, consistent time waking up. Anything else?
Time between the last meal and
Yeah.
right.
Yeah. Again, 7 p.m. is usually a nice cutoff in terms of no more eating either.
4 hours before you sleep.
Yeah. Now, if you must, there is a food that is you don't want to. I mean, it should be low carbohydrate. You don't want to give your system, your metabolism fuel. So there is usually a lower carbohydrate, which is calorie dense. So it doesn't really take that much to fill a person. And by the way, it also contains tryptophan too, which is always helpful for sleep too. What am I talking? Yeah, as long as you don't have any allergies. Peanut butter. A couple of tablespoons. I'm not sure this much you're going to need after that. Anything else? I think one of the things that's really obvious is that you really have to take inventory of your bedroom. So it really should be dark enough, it should be cool enough or warm enough. It should be comfortable enough. And that includes smells as well. So you really have to optimize your sleep environment. We talked about, the bedroom's only for sleep or sex, but the bedroom itself has to actually be optimized. Right? So noise level, lighting. Right? So that's got to be taken into account as well. Anything else?
The time, how long will they stay if they're not they're not falling asleep?
We're going to get to that next.
Yeah.
The only other thing I think in terms of, and we probably missed a couple, but the one thing that comes to mind is exercise. Right? I don't want you to run any marathons at 7 p.m. either. Right? But on the other hand, exercising 5 times a week is suggested. Right? All right, that's proper sleep hygiene. Now, the majority of individuals who you discuss this with will come back, whether it's 1 week, 1 month later, telling you that it has not worked. or if it is working, it's not working up to their expectation. The next step is keeping a sleep log for sleep efficiency. That's the next step, right? So there's different behavioral things you can do in addition to. So it doesn't mean you now abort sleep hygiene. You continue that. And then you add to it some behavioral modification. Here we talk about sleep efficiency. The time sleeping over time in bedroom should approach 1. And the way to get that ratio to 1 is that after 20 minutes of being in your bedroom and now being awake, get out. Leave, because you don't want to start making that association, even unconsciously, between wakefulness and that bedroom. When you're tired again, go back in. 20 minutes later, if you're still up, okay, you might be up all night. Right? And if you are, the next night, you may be up for a significant portion of the night, but it will be less than the night before. Okay, don't 10 minutes less, but it'll be less. Over time, you're going to begin approaching 1, right? And it might take time, but you'll get there, right? So that's keeping a sleep log, that is calculating sleep efficiency, and that's that behavioral modification as well. Right? If that fails, in addition to sleep hygiene and behavioral modification, now you're thinking psychotherapy. And here, a referral to cognitive behavioral therapy is likely indicated. Right? A formal referral for psychotherapy. And then if that is tried and if that is unsuccessful, with continued therapy, continued behavioral modification, and continued sleep hygiene, now we can consider the judicious use of medication. But only then. Right? That's the 4-step approach to insomnia. We could talk about sleep meds in another context in another day, but that would lead us up to that discussion. Final thoughts. John Carpenter's A Thing. All right. I don't know if Twitter's already posted it, but next week we'll be doing Jaws. It's that time.
It's like that.
Right. All right, we'll leave it there, and we'll see everybody back next week. Thank you.